How do you know if that pain you're having is coming from your ear or your TMJ? Well, in this video, I'm going to discuss the potential causes of that pain and what you can do about it. Coming up. Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Anthem, Arizona. And on this channel, I cover a bunch of hearing-related information to help make you a better informed consumer. So if you're into that, consider hitting the subscribe button. One thing you probably don't know about me is that I actually used to be a massage therapist. When I was going through my undergraduate studies at Lindenwood University, I actually got my massage license beforehand and started up my own massage clinic so I had something to do while going through school. And I actually ended up building up a pretty decent sized clinic, and I would focus mostly on medical or sports related issues. One thing people would often come in with would be jaw pain or TMJ dysfunction. And massage therapy is actually a really effective method of treatment for TMJ dysfunction. But one thing I noticed a lot was people would come in for this jaw pain and it actually ended up not being jaw pain at all. And so I would end up referring them to an ear, nose, and throat specialist in order to identify if it's actually an ear problem or a jaw problem. Now obviously the ear and the temporomandibular joint are closely located, so it's really hard to identify which one is actually causing the pain. Problems with any one of them can actually refer pain to the other area, so identifying this pain can be very difficult. Now often if this is a TMJ issue, it's likely caused by the masseter muscle being too tight on the particular side that you're having the pain on. And this masseter muscle can become tight for a variety of different reasons. Maybe you're clenching your jaw, maybe you're chewing on gum on that side exclusively, or maybe you have a dental misalignment problem. And in some cases it can even be arthritis, which can accentuate the problems as well. Now, if this pain is coming from the ear, it can actually be a little bit more serious. Things like impacted earwax or negative middle ear pressure from an ear infection or swimmer's ear, which is also known as otitis externa. But even more seriously, you could have cholesteatoma, which is actually the growth of epithelial cells in your ear canal or your middle ear space that can actually really wreak havoc on your ear. And all of these situations can cause pain that you might associate to be jaw pain. Now, if the cause of this pain is actually your ear, it can actually lead to issues like tinnitus, which is that ringing and buzzing sound that you might hear. And the stress associated with either the TMJ pain or the ear pain can actually make tinnitus worse or make you perceive it worse than it actually is. And so until you get the problem corrected, it's likely that this tinnitus issue, if you're having it, will be perceived as more severe. Now, pain is pain, so how do you actually identify if this pain is being caused by your ear or being caused by your TMJ? Well, the first step that you should really be taking is going in to see an ear, nose, and throat specialist, otherwise known as an otolaryngologist. Together with an audiologist, they can test your hearing and use observation to identify if it's actually an ear problem or not. If it is an ear problem, they'll be able to start on the appropriate treatment sooner. In some of the more serious cases, like if it's a cholesteatoma, that cholesteatoma surgery can be scheduled sooner rather than later. Now, if ear-related issues are ruled out, that's really good news. That means it's likely TMJ dysfunction. And like I said before, as a massage therapist, the majority of causes of TMJ dysfunction is an imbalance in the masseter muscles, with one being too tight and the other side being a little too loose. I'm going to give you a simple little self-massage technique that you can use to help relieve some of that jaw pain. What you'll do is you want to take your thumbs, push in on your masseter muscles, and push them down. What this does is it stretches out both sides and actually aligns it a little bit better. If the side that you're having the pain on has a knot in there or you feel like it's excessively tight, you can actually take and do what's called cross fiber friction and go back and forth sideways on the muscle. And then when you're done doing that, you're going to want to push in and stretch it down again. You always want to make sure that you're keeping both of those muscles the same length. And so you do want to treat both sides, not just the side that you're having pain on. Another thing that you can do is actually push in on that masseter muscle while you're clenching your jaw. That helps loosen the muscle up, and then again, when you're done doing that, you want to let your jaw go relaxed and stretch those muscles down on both sides. Now, self-massage is great, but often going to a licensed massage therapist is even better. They have more techniques that they can use, and they can do it much better likely than you can yourself. But if you end up going to a massage therapist and you're doing self-massage and you're not seeing any improvement after a month or two, then it's probably time to go see your dentist to see if there's some kind of dental issue there and to see if there needs to be some kind of realignment done with that. I want to make sure that you understand that the first thing you should be doing is getting any kind of ear problems ruled out. And this means going to an ear, nose, and throat specialist that has an audiologist so they can rule out any kind of ear-related issue. Once that's ruled out, then you can focus primarily on the TMJ, which is the likely cause if it's not being caused by the ear. And this would include going to a massage therapist and doing the self-massage technique that I taught you a little bit earlier. If that's not helping after a month or two, then you should really be going in to see your dentist to see if it's an actual dental issue that's causing the problem. That's it for this video. If you have any questions, leave them in the comment section below. If you liked the video, go ahead and give it a thumbs up. And if you want to see more videos just like this one, go ahead and hit the subscribe button. I'll see you next time.